Tina had a distal radius fracture and an ulna fracture. Am I right? Yeah. Well, first we'll take a look at the skin, right? So there's obviously a difference in coloration. What's really nice is I always look at the back of the hand and I compare it. We want to see wrinkles, and we see wrinkles. That's a really good thing. Before, we didn't see as many wrinkles, right? So I always tell our patients like what to look for. We're seeing wrinkles. The other thing that we're looking for is like, you can relax your fingers. We're just looking for the natural attitude of the hand. And here you're going to see, already I could tell that these knuckles they're stiff, and she's contracted a little bit right here, right? These middle knuckles are always your problem child knuckles. They're always the ones that get real stiff, real tight. But you can see how like she's red around the knuckles is because the swelling tends to sit in the big knuckles too. It's like little pockets in the big knuckle, and it holds a lot of the liquid. You can see that. So she had a distal radius fracture. She got real stuck, and she just had a capsulectomy last week for supination, pronation, as well as the manipulation of the fingers and the wrists, right? Yeah. Now, usually when I look not just at skin, I look at the natural attitude of the hand, but I'm also looking at like what she has pre-existing. Usually with the hands, if you have arthritis or anything like that, you can see it in one hand as compared to another. Like sometimes people's natural positioning of their fingers are a certain way. So you're just looking to compare it to the other side so that you're not trying to do something that they don't need. So some people are like, well, my finger is like this. Why is it like this? And then people think that something is wrong with it. But if you look at the other hand's exactly the same way. There might not be anything wrong with it. It just might be how you are, and you're perfectly fine the way you are, right? So go ahead and just bring your wrist up. Now keep your arms down like this, and just bring your wrist up like this. So right there you can see how limited she is, right? Relax. And always when you're looking, you're not looking here, you're gonna all look at like how she moves her arm, because that makes a real big difference in compensatory types of habits that people create after an injury. So right here, turn your palm up, right? So this is why she went for surgery. Usually what I look at is I'm looking at like how much it can move, the forearm. Now turn your palm down, and then turn your palm up. So Tina already knows, because she's been with us for a little while, she knows that she's trying to keep the arm by the side. Right? Turn your palm up and turn your palm down. People who can't turn start to use your shoulder. And if you see, you see a little bit of movement there, but she's being really excellent right now because she knows that that's one of the things that I look at. So a lot of times when people can't turn their palm up, what they do is when they can't turn their palm up, they dig their arm into their side. And when they can't turn their palm down, they wing out their elbow, right? So anytime you have someone who can't turn their palm up and down, they tend to have rotational, stiffnesses in her shoulder, and she does have it, but it's gotten better, right? So she had the capsulectomy.